Hello everyone, welcome to our presentation. We're Team 3.
So the key problem is that climate change has caused more frequent occurrence of extreme weather, which increases the health risks for outdoor exercising, especially for elderly who has weaker tolerance to extreme temperatures. The significance of this is that regular exercise is actually extremely important for health as it reduces the risks of major chronic diseases such as coronary heart disease, stroke, and diabetes, and it reduces the mortality rate and helps with mental health improvement by reducing stress and depression. And health risks increase when exercising under extreme climate as it may lead to dehydration, heat stroke, and hypothermia. And by inhaling more air pollutants, it may irritate the respiratory system and increase the cardiovascular stress and systemic inflammation.
This problem affects older adults, especially those over 16. 90% have at least one chronic disease, and 80% have two or more. But it also involves middle-aged adults. Their habits like diet, exercise, and stress management strongly impact how they will age. In fact, 8 in 10 already live with at least one chronic condition, and people with chronic illness face greater risk of disability and losing independence. Behind these are social and cultural factors. Modern lifestyle lead to more sedentary behavior and poor diets. Work stress increases the risk of heart disease. And with world population rapidly aging, 20% will be over 60 by 2050. Our systems are under pressure. At the same time, smaller families and inequality leave many older adults alone, with less support and worse health outcomes. And the who remind us, life expectancy is increasing, but healthy engines is not guaranteed.
My name's Sarah, and today I'm going to be talking about the evidence for the key problem worth solving. The increased incidence of natural disasters and prolonged extreme weather events has proven detrimental to the aging population. As climate change intensifies, extreme weather events are not just disruptive, but can be life-threatening for the older generation. Many older adults have chronic health issues or reduced mobility, making them more susceptible to climate-related health risks. And to make matters worse, the prevalence of social isolation has been found to increase with age, which further compounds the risks faced by the elderly. As you can see on the slide, I've chosen 2 case studies to exemplify the need for our key problem to be evaluated. Firstly, as a result of cold stress, approximately thousands of elderly people in the UK sadly freeze to death every winter. And Beijing heat-related mortality projections suggest that related deaths could rise by a shocking 265% by 2080. These cases essentially sum up the climate crisis we have at hand, and it is imperative that a solution be found to combat this.
But the potential solutions already exist. First is urban green space, designed as natural summer shelters for the elderly, with half of Barcelona people use it to calm down on hot days in the morning or evening. Second is the air-conditioned public space, a temporary relief measure during heat waves. Some governments also publish the physical activity guidance for elder people, aimed at building heat tolerance throughout life. What is our proposed solution? Our solution is to create a multifunctional sustainable community center that combines wearable devices with smart health monitoring systems. To introduce a new multi-live access model, digital technology is used to maintain social connections when outdoor activities are limited, and the caregivers can provide timely monitoring and personalized guidance.
This proposal will benefit primarily older adults with limited mobility and chronic illnesses, but also caregivers and family members, public health system by reducing the chronic disease burden, and urban communities vulnerable to climate-related risks. How will we measure this impact? Well, primarily by quantitative and qualitative indicators, such as changes in physical activity levels that will be measured by the wearable devices, self-reported well-being and mood, reduction in sedentary time and preventable medical visits, participation in digital exercise programs and community workshops, and with feedback from the elderly and caregivers on overall ease of use and satisfaction.
So, who will involve in delivering the solution? The successful delivery of this solution will require collaboration among multiple stakeholders. So, for example, healthcare professionals like doctors, nurses, physiotherapists, to develop and adapt personalized health and exercise plan for elderly users, caregivers, and community workers to assist with daily monitoring, support social interaction, and facilitate access to the different resources. Technology developers to design and maintain wearable devices and smart health monitoring systems, urban planners and architects to design and implement elderly-friendly, climate-resilient community centers that integrate fitness, cooling, and social spaces, local governments and policymakers to provide funding, regulatory support, and infrastructure to implement the model at a community level, and of course, older adults and their families as active participants and feedback providers to ensure the system meets real-life needs. So this project is unique and special because we are involving technological innovations to enable continuous personalized health tracking, climate resilience throughout the design of multifunctional community centers that offer cooling zones and safe indoor places for exercise and socialization, especially during extreme weather. Of course, social well-being by maintaining connectivity even when physical distancing is necessary. Digital health programs reduce isolation and promote mental health.
First, extreme weather can make outdoor exercise unsafe. We propose climate resilient community centers to provide cooling, fitness, and social interaction. Digital literacy gaps can be mitigated with comfortable and senior friendly user design. We'll also seek government funding and nonprofit support to tackle financial accessibility. Finally, we'll provide exercises for a diverse range of physical abilities through multi level personalized exercises. Thank you so much for your time today.